There appears to have been a change in the virus's behaviour. How worried should we be about monkeypox?
Well, I don't think we need to be panicking at this point, but it is quite concerning that it has spread so widely within Europe initially. It seems like the cases that have occurred in multiple countries in Europe, North America, Australia, and so on have originated from the UK, probably, as well as some super spreading events in Spain, particularly. And that's the first time really since monkeypox was first known to infect humans, which was in 1970, that we've seen travel-related spread from outside of the African continent. And of course, there seems to be substantial human-to-human transmission occurring in those outbreaks.
Is it clear why that's happening now?
No, it's not. There's some speculation in the UK that it might have been circulating undetected for the last few years. There was the first imported cases into the UK occurred in 2018 and again in 2019. It's also been spreading largely, but not exclusively, in communities of men who have sex with men. So whether there's also been speculation as to whether it's sexual transmission, although when you've got really close contact in intimate contacts, it's hard to say which specific transmission it is.
So monkeypox is not described as an STD, but to what extent can we think about it in those terms?
No, it's never been described as an STD. In the normal clinical presentation of monkeypox, most people will get a rash on the face, followed by the next most frequent site is the palms of the hands and the soles of the feet, but about 30% of people get a genital rash. But the other thing is it's not as well studied as some other diseases because it's been a relatively infrequent disease, and it's only really started causing big outbreaks since 2017.
Are there particular communities that are more vulnerable than others? You mentioned the queer community, where the CDC in the US has certainly put out a warning saying that people in the LGBTQI+ community are at a somewhat elevated risk.
Yeah, I mean, that's where it's spreading. Most of the cases there's a male predominance in the cases, and a majority of cases have been linked to either particular super spreading events and have been in men who have sex with men. So I guess, being on and several patients have presented to sexual health clinics. So I guess it's really important that there's awareness that monkeypox is around.
What are the key symptoms that people should look out for?
So it starts with malaise and fever, swollen lymph nodes, and then the rash appears after that. So the rash can start in the mouth, so it may not be noticed. And then when it appears on the skin, obviously it's noticed.
When monkeypox first popped up in the news not long ago, I know a lot of us kind of took a deep breath and thought, gosh, not another one. What is your message for people who might be concerned about this, particularly considering all we've dealt with in the last couple of years with COVID?
So monkeypox is not very contagious between people. So and we don't expect that there's substantial asymptomatic transmission. So those are two areas in which it differs from SARS-CoV-2, for which there is substantial asymptomatic transmission, and it is easily spread between people. So monkeypox is much less contagious, much less, I'd be very surprised if it takes off in the same way that SARS-CoV-2 did. So it should be easily controlled with vaccines and easily treated with antivirals. The way to use vaccines, though, in this case is to contact trace and vaccinate the contacts. That's called ring vaccination, and it's a strategy that was used to eradicate smallpox from the world.